Let's talk about scalp laceration repair. If you are trying to repair someone's scalp laceration, try not to shave the person's hair because you can actually increase the risk of infection. If the wound edges are not easily visualized, you could always mat them down using some kind of ointment, either by using bacitracin, zinc, or petroleum jelly. As a last resort, you could always cut the hair around the edges of the wound in order to better visualize the wound. You could use some monofilament sutures, or you could either use surgical staples when trying to close scalp lacerations. If you are opting to go for sutures, you could leave the edges of the knots longer and try and use a suture that is a different color from the hair of the patient. So easier choices would be either something like Proline, which is a non-absorbable suture, it's monofilament, or something like Vicryl Rapide, that is a rapidly absorbable monofilament suture. Another technique that you could use to close scalp lacerations would be to try and braid the hair together from the opposite edges of the wound. So you take 3 to 5 strands of hair from either side, bring them together, braid the hair on top, and drop a little bit of tissue adhesive on the braid itself to try and keep the wound edge approximated. I would only use this technique in patients who have scalp lacerations that don't have a lot of tension and are not gaping and you could easily approximate the edges. Always make sure that you put a dressing on top of the scalp laceration that is repaired in order to prevent a hematoma formation, because remember that a scalp has a very rich blood supply.